Hello, my name is Dr. Jason Mazzarella. Today we'll be offering a virtual PPN treatment service to help those involved in motor vehicle accidents. Our virtual telemedicine services allows for the establishment of an injury diagnosis and virtual treatment. We can assist your insured with completion of all required OCF forms and provide doctor-to-patient live streaming treatment through several different platforms including Apple FaceTime and Microsoft Skype. This is how our service is unique. Our ability to diagnose your insured is based on the latest research in accident reconstruction and crash forensics. With crash forensics, we consider over 50 unique risk factors per collision, as well as human factors, collision factors, and vehicle factors to determine the injury potential of an occupant in a motor vehicle collision. Here's how it works. As a certified crash forensic specialist and accident reconstructionist, I can take collision factors to determine injury potential. In this example, if an insured stated that they were the driver of a vehicle that was struck on the side in a far side T-bone style collision, understanding of crash forensics allows for an injury determination because we know how the occupant will react and what soft tissue structures are most likely to be stressed. In this example, we can see that the right anterior neck and left posterior neck soft tissue structures will most likely be stressed. By understanding the forensics, we understand how the seatbelt will interact on the occupant and what surrounding soft tissue structures are most likely to be injured. Then during our initial in-person virtual telemedicine conference, the subjective reports of pain from the insured can be compared to the known kinematic responses just shown to develop an injury potential. If the insured reported headaches or neck pain, we would then know that there is a high probability of upper trapezius injury or SCM injury. And we would provide appropriate exercises and physiotherapies to address those issues. In addition, based on the concept of a continuous tissue tract shown here on the right, we would know that involvement in one muscle could lead to dysfunction throughout the rest of the tissue tract, as shown here. So we can specifically question the insured about pain in secondary regions to ensure the best possible care. In this example, we would ask about tightness or pain in the hamstrings or the calf muscles. Our virtual treatment service works through a four-step process. First, we provide posture modifications and physiotherapy recommendations to control inflammation and reduce pain based on the insured's specific injury pattern. Step 2 is active range of motion exercises, and step 3 and 4 transition into a graded strengthening protocol to allow for recovery and assist in prevention of symptom re-exacerbation. This is important for your insured for 4 specific reasons. First, cost containment. Secondly, improved function. Third, reduced likelihood of chronic pain. And fourth, future medical legal implications, which we'll get into in a moment. Motor vehicle trauma research has shown approximately 52% of those involved in motor vehicle collisions will sustain an injury that requires or warrants treatment. Research has shown 1 out of 2 people develop injuries, and out of those, 1 out of 2 develop chronic pain. Research has also shown if appropriate treatment is not provided in the first 21 days, but that could range between 2 to 4 weeks depending on the person and their past medical history, that the collagen fibers, which are these pictures here, they're the smallest structure of the muscle. They will heal structurally intact but functionally weak. What that means is this picture here is a picture of collagen fibers. They're intact and not injured. After an injury occurs, we get tearing in this structure here. If we don't put the appropriate stresses into these muscles, what happens is the collagen fibers will re-heal, but they'll heal structurally intact and functionally weak. We have less cross sections. When this happens, this alters our biomechanics, and this can lead to a pain cycle, which we'll discuss a little bit later on in the presentation. If we look at long-term research associated with motor vehicle trauma, one of the longest studies completed was by Squires, which looked at motor vehicle accident victims over a 15.5-year duration. His findings found that 70% of people continued to have pain 15 and a half years after the motor vehicle trauma occurred. His findings reported 18% showed improvement and 28% showed deterioration over that duration of time. A slide by Stanford Medicine that shows why lack of treatment can lead to chronic pain. The diagram shown is by Dr. Cove's Stanford Medicine Pain Department. If we look at the first portion of the slide, this is when an injury first occurs. You undergo a nociceptive response which results in pain, inflammation, and limited range of motion. This is why and where we have to implement in-home physiotherapy services such as TENS units, hot and cold packs, and biofreeze. The second phase of pain occurs if treatment is not provided, and this results in a negative cycle due to hypersensitivity, meaning a reduced threshold for pain response occurs. If we look at the very top blue arrow, this is actually why pain medication does not work for chronic pain, as it results in a negative central sensitization loop which actually continues and increases the pain response. This slide has been provided to show why we have to treat pain in the acute and subacute stages. Once we pass these stages, we get a neurological change in the spinal cord, and this results in a hypersensitivity. This example here shows the spinal cord, and there are different lamina or layers. Lamina 4 and 5 do proprioceptive information for the most part. This allows you to know where your body is in space so you don't trip or fall. Lamina 1 and 2 have a high threshold of pain fibers. If you've had pain for a decent amount of time, what happens is the fibers in lamina 4 and 5 start to move into lamina 1 and 2, or it's called sprouting, neuronal sprouting. And then what happens is a less stimulation of pain can actually cause more of a pain response. So you can feel more pain than you're actually experiencing. And this is hypersensitivity or chronic pain. So if we don't treat in that subacute or acute phase of care, and we allow pain to progress to this, one of the primary treatment options is medication or opiate usage. I've provided several slides here that were obtained through the American Academy of Pain Management during their scientific conference. Initially, when you take an opiate, what happens is it has an analgesic effect for several hours. As you take that opiate over and over again, you still maintain that analgesic effect, but you have something called a rebound phenomenon where you actually feel more pain as that medication is wearing off. As this continues, the analgesic effect reduces and the rebound pain increases. And eventually you get a very short duration of analgesic effect with a very long duration of something called hyperalgesia or increased pain. Then what will occur is the benefit of the opiate will start to be variable, where it might help for a little bit of a duration and then increase pain for a little bit of a duration. And at the end, it becomes very erratic, where it could be reducing pain for a couple minutes here, and then a half hour later, it increases pain. An hour later, it reduces pain. And the benefit of the opiate is basically reduced at this point to where it provides no real pain relief. And to get to this stage, it's only about 30 days of continuous usage. The third phase of this pain cycle is why timely treatment for your insured is so important with this program. As I previously showed, if treatment is not provided in the first 3 to 4 weeks, the smallest portion of the muscle, the collagen fibers, will not heal correctly. This will result and lead to changes in posture and biomechanics of the person. This is indicated in the pain cycle with the black arrow. This results in a pain loop where the person in pain will continue to increase their pain over time as their biomechanics continue to be altered and change. As the biomechanics change, this causes continued inflammation, and the inflammation causes continued nociception, which then continues the cycle of pain. Our virtual telemedicine PPN treatment program is designed to address the acute and subacute stages of care. We accomplish this through the provision of virtual exercises, where I perform stretching and strengthening exercises with the insured in real time, and then provide videos of those exercises for review, which are online. We also provide biofreeze, TENS units, and hot cold packs, which will be shipped directly from the manufacturer to your insured's home. And we will provide instructions on usage in real time through video conferencing. So with this program, we can provide the insured in-home exercises such as a trapezius stretch where we show them how to do it, and in real time we watch them do it to ensure that they're doing the posture and motion correctly. We can also provide physiotherapy devices in-home, shipped directly from the manufacturer. Once they receive this, we can tell them where to place the pad, how long to place the pads on, for what duration and intensity. We can tell them where to place the heat and where to place the ice, and we can watch it virtually as they're doing that treatment. So in essence, they're getting a physiotherapy treatment. They're just getting the treatment virtually instead of in a clinic-based setting. This program allows for immediate care, which will allow for treatment within the minor injury guideline. We have the ability to exhaust all extended health first, and the program is supported by my credentials and training in whiplash, motor vehicle trauma, and pain management. This program will not only help your insured, but help to reduce your potential liability as well. Right now, lawyers are stating on social media that all patients should be approved until this COVID crisis is over. Just yesterday, Justin Trudeau stated that the crisis could last months. Lawyers are also stating on social media that due to delayed care, all persons should be taken out of the minor injury and all persons will have suffered psychological distress. Our program limits these claims and reduces your liability post-COVID. I have provided several screenshots from my LinkedIn account, which shows lawyers and prominent firms in Toronto which are already proposing these changes. And for insurers, these requests hold merit if treatment is not approved and provided. If we look at the minor injury guideline, 3 key factors described in the MIG include functional restoration approach, which will not occur without timely treatment as shown previously due to altered collagen formation. The minor injury guideline also states that it is intended for the treatment within the acute and subacute stages of care, which includes the first 2 weeks post-trauma, and states that it should not exceed 12 weeks post-trauma. Our program allows you to stay within the minor injury recommendations while helping your insured recover from injury and reduce your current and post-COVID liability. The program is very simple to implement. Your adjusters only have to ask if the insured has access to an Apple product or computer with Skype. If so, they can offer the service by informing your insured of this new and cutting-edge treatment service offered by Dr. Jason Mazzarella and can mention any of the credentials listed in point 2. Finally, if the insured agrees, the adjuster only needs to email me the claim and contact information, and I will take it from there. I will contact the insured, schedule the virtual treatment sessions, complete the OCF forms, and provide the appropriate therapies. Thank you for your time and consideration for our cutting-edge virtual PPN treatment program.